we got an interesting child. The child is now 18 days or 20 days? 20 days. So 20 days old. It's a child who was referred to us from a private medical college. Diagnosed with a tumor at the time of pregnancy itself. So 20th week scan, they had actually identified that the child had a very large tumor. So the child had obviously gone to various places for scan. Some people had advised them to abort the child, thinking that it is a tumor arising from spinal cord. But then the child also went on to have an MRI scan in pregnancy. This is again very rare. So pregnancy time, very rarely few places they do an MRI scan of the baby. So they did an MRI scan which detected that this tumor was coming very close to the spinal cord and it was grown very big at about 30 weeks. So anyway, the parents decided to have the child. The child was born with normal delivery, and after that the child was referred to us because they didn't have the expertise to do that in the private hospital. It's a medical college hospital. So with the child we shifted on the 5th day after birth. We shifted the child, and then after that what we did is we had a discussion what this tumor could be. We had a few differential diagnoses of what it can be, either something coming from the spinal cord or a tumor coming from the bone or the tumor coming from the muscle. So it was a very aggressive looking tumor. We will pass around the photograph of the tumor. The tumor was actually the size of the child's head itself, a very large tumor, the size of the child's head. And after that, they obviously after discussing with the family, they are not coming from a very affordable background, so they could not afford this surgery. So they were trying to see a place where they could do. So fortunately, we did this operation under the Tamil Nadu Chief Minister's scheme. So we were able to help them. Although it was a good 6 to 8 hour long surgery, and most private hospitals would not obviously do this kind of a tumor. So we done it. So what I suggest is we can send the child down back. So if anybody wants to see the child, Sivasankar is the pediatric surgeon, Dr. Sathish Manivel is the plastic surgeon, and Dr. Lakshmi is the pediatrician. So very small children, babies, you need a very specialized team. The child is only 2.9 kg when the child we operated. So a small child with a major 8 hour surgery, we need to give anesthesia. So that also is a full team. So it was really a teamwork. So and the child is fine. So I know probably 2 to 3 days we will be discharging the child.
It's a big tumor, first of all, and I feel picking up this antenatally and getting an MRI done antenatally, quite a lot of things have been done, what would have been done abroad also. And I think the way we have worked as a team and as a surgical team as well as with the NICU, actually we've done an excellent camp today. That's what I think. And tumor was quite vascular, with a lot of blood vessels and invading the vertebral column. So it was quite a tricky job to take the tumor out without much bleeding. That's what we did.
So in our children is where you should not lose too much blood during surgery. So it has to be very, very meticulous. The entire blood volume is probably around 250 ml now, our entire body. So you cannot lose more than 20. It took a lot of time to very slowly try and hold all the bleeding, and also it was quite a long procedure for a small child.
In addition to the team of doctors, the hospital, treatment hospital should have excellent nurses and paramedical staff to take care of the child in that post-operative period. So the success that the child has done well and we are planning discharge in the next 2-3 days shows the nursing team has also done a great job in managing the child post-operative.
Post-operative also is very, very important. I think Dr. Lakshmi can add.
The surgical team for their excellent job, because my job was fairly easy in the ICU thanks to the surgical finish. So it was a holistic approach what we did, a multidisciplinary approach. Everybody had their role to play, and I guess everyone rose up to the occasion, and which is why you can see the end result. See, managing newborns is especially challenging, not just in terms of the doctor who is managing the child. As Dr. Sathish said, the nursing care. They need tender, loving care. Imagine giving tender, loving care in an ICU. So that's what we are good at, and what you see is the fruit of our action.
நம்பிக்கையாக சொன்னார் 100% க்யூர் பண்ண முடியும் அப்படின்னு சொல்லிட்டு எக்ஸலண்ட்டாக சேலஞ்ச் பண்ணி இந்த ஆப்ரேட்டை சக்ஸஸ்ஃபுல்லாக முடிச்சிருக்காங்க. நான் பயந்துட்டு இருந்தோம் இந்த மாதிரி ஒரு டீம் இருக்கிறதுனால குழந்தைங்க என்ன பிரச்சனை வரும் அப்படின்னு சொல்லிட்டு. மேக்ஸிமம் ஒரு 5 kg கெயின் ஆனால் தான் குழந்தை ஆப்ரேட் பண்ண முடியும், ஆப்ரேஷன் பண்ண முடியுன்றனால மாறி சின்ன 20 days சில்ட்ரன்ஸை குழந்தை சக்ஸஸ்ஃபுல்லாக ஆப்ரேஷன் பண்ணி